Hi everyone, welcome back to our channel. Today we're diving into an important health topic, how doctors diagnose type 1 plasminogen deficiency, or PLGD1. This is a rare genetic condition that can lead to issues like ligneous conjunctivitis, a thick recurring inflammation of the eye, among other symptoms. Let's break down what patients and families need to know about the diagnostic process. The first step in diagnosing PLGD1 is often noticing its hallmark symptoms. People with this condition may experience growths or lesions on their gums and eyes. They may have frequent respiratory issues, and in some cases, stomach ulcers, other gastrointestinal problems, chronic ear infections, or respiratory symptoms like a cough that won't go away or frequent pneumonia. Neurological symptoms can also occur. If any of these symptoms sound familiar, it's worth talking to your doctor about whether further testing would be useful. Now, the actual diagnosis involves a blood test. You will have a normal blood draw from your arm, say, and the blood will be sent off in a light blue top tube for testing. Doctors will check two different markers from your blood. First, a plasminogen activity level, which measures how well your plasminogen protein is working to break down scar tissue and fibrin. Low activity levels are a significant indicator of PLGD1. The second measurement is a plasminogen antigen test, which looks at the overall level of plasminogen in the blood. Together, these two measurements can help doctors diagnose type 1 PLGD specifically. A few key things to know here. In PLGD1, both plasminogen activity and antigen levels are low. If only the activity is low, but antigen levels are normal, it suggests type 2 plasminogen deficiency. Patients with type 2 typically do not have any symptoms, but patients with type 1 PLGD do have symptoms. Here are some things you do not need to diagnose PLGD1. Genetic testing. While this can be helpful for ongoing studies of PLGD1, it is not necessary to diagnose the condition. And biopsy or pathology of the lesions. Removing lesions can often lead to more harm than good. While there may be times when removal is necessary, removing a lesion solely to send for pathology is not necessary for diagnosis. After these tests, many people with PLGD1 are referred to a specialized care center, often a hemophilia treatment center, or HTC. This is where you get a team of healthcare providers, including hematologists, who understand and treat rare bleeding and clotting disorders like PLGD1. They'll coordinate your care with other specialists, manage treatment, and can help train patients to administer replacement therapy like Riplazine. We'll talk more about the benefit of getting care at an HTC in another video. So, to recap, diagnosing PLGD1 involves identifying symptoms and doing a blood test to look at the plasminogen activity and plasminogen antigen levels. It's important for patients with PLGD1 to have a comprehensive care team, which can be found at an HTC, because this condition can impact multiple systems in the body. If you or a loved one has symptoms like chronic eye or gum issues, talk to your healthcare provider about getting tested.